So today is for TDM. For those who don't know a lot about this, the TDM is the exam, those who are going to do the practice ready assessment. So the SIPA, the Better Practice Ready Assessment Program, that's the exam they take, okay? And so maybe today can give you a very good overview for the whole program. Okay, so Dr. Humera has raised her hand. Dr. Humera, please unmute yourself and let's go. Okay.
Yes, hello.
Yes, please.
Yeah, the question one is a 56-year-old patient on pantoprazole for acid reflux and currently on day 7 of a 10-day course of oral ciprofloxacin for an infection comes into the clinic with a history of 4 days of watery, foul-smelling diarrhea. He is hemodynamically stable. What is your diagnosis?
Yeah. So what do you think it is? So doctor, what is your answer for this one?
Maybe that's the antibiotic induced.
Okay. Antibiotic induced diarrhea. What else? What else?
And he's taking pantoprazole.
Yeah. So what do you think this is pointing to? Taking pantoprazole, taking antibiotics, developed diarrhea, and the diarrhea is very, very foul smelling. What do you think is going on? I'm getting quite a number of answers. Difficile diarrhea, yeah. Some that people are saying this could be Clostridium difficile diarrhea. Any other answers? Any other answers? Any other answers? Sure. So I think the reason why we put in it there is it's Clostridium difficile infection, and the reason is because pantoprazole itself, like proton pump inhibitors themselves, can predispose to that, and the person is also on antibiotic as well, and the person is having foul smelling diarrhea. So this is C. difficile infection. Dr. Batu, will you want to continue or you want someone else to read? We are looking for volunteers to read for us, volunteers to read. So I don't know if you want to continue. So it's the same preamble. Okay. Maybe
should I or somebody else?
Maybe let's allow Dr. Muhammad. And then after that, Dr. Misbah will take the next question. So Dr. Muhammad, what's the next? How are you going to approach the next question? And read the question for us. So it's the same preamble. So maybe focus on this part. Yeah.
56-year-old. Okay. So what medication can you prescribe for this condition? Indicate the dose and list 3 of them.
Beautiful.
So Clostridium difficile.
Yeah.
We have to stop that medication first of all.
Oh, no, wait. What does the question say, please? It says, what medications can you prescribe?
Prescribe, okay.
Yes, yeah.
Okay, so we need to give antibiotics.
Sure, antibiotics. So which one will you give?
Vanco.
Vanco, what is your dose and route?
Okay,
but remember the question is in 3 steps. What medications can you prescribe? And then indicate the dose and the route, and they want 3.
Okay, so we can give them vancomycin. He's hemodynamically stable, so oral will be fine.
Oral, okay, sure.
Yes.
And then what is the dose?
I don't know what dose they have here.
So you don't know the dose. Okay, that's fine. No. And then what about the routes? You said oral. Okay.
Oral, yeah.
Okay, what else? What else can you give? Because the question wants 3. So you've been able to give me Vanco oral. So the first one, assuming it is scored 3, you scored 2/3. That's good. What else?
Metronidazole.
Metronidazole, how much?
500 milligrams.
How much? Hello?
Metronidazole, 200 in the morning, 200 in the evening, 2 times.
200 BID. Okay.
Yeah.
That's right. Candidate, is that right? Metronidazole, 200 in the morning, 200 in the evening. Is that right?
No.
Okay. So what can you do?
500.
So metronidazole, 500 milligrams. How often?
3 times.
3 times a day. Okay. And then what's the last one? What's the last one? What's the last one? Okay. Yeah. So this is a teaching point for us. So, and I'm going to give you one exam trick in the TDM. So it is vancomycin 125. Don't worry about this. We'll send this video to you, okay? Vancomycin 125 milligrams QID. That's 4 times a day by mouth times 10 to 14 days. And then metronidazole 500 milligrams TID PO times 10 to 14 days. And there's another medication called fidaxomicin. Fidaxomicin. It's becoming very popular. That's why I put the question there. That is 200 milligrams PO BID times 10 days. Okay. Now, one trick with this exam is that you remember that I wrote 10 to 14 days. All right. 10 to 14 days. What you have to notice that in the exam, if they say write the medication, a dose, a route, and duration, don't write it in, say, 10 to 14. Just choose one. If you write 10, you'll be right. If you write 14, you'll be right. You know, there are some medications as well, like maybe Tylenol, where maybe you can write 325 milligram to 650 milligram, or even 325 to 1 gram PO, kill 4 to 6 hourly. Don't do that. Just write maybe 650 milligrams every 4 hours by mouth for 7 days. What I am using this for just teaching purposes, but don't write ranges, please. Are you getting me? Don't write ranges in the exam. Don't, because that is a wrong exam technique. The MCC has stated categorically on their website that they will not accept, ranges. Rather, write the exact duration. Okay, Dr. Mohammed, please bring your question. Please bring your question.
So I was just going to ask, like what we practice back home, like we have different ranges, so that should not be included in this exam, right?
No. Just use the Canadian ranges.
Oh, okay, got it. Okay.
Ranges. Yeah. Okay, good. Let's go. So, Doctor, I think I've forgotten the name. I think someone else, Mbiba or something. Someone else raised the hand to.
Yeah, it's me, Misbah.
Yeah, Misbah, Dr. Misbah, please, let's go.
Okay, the patient inquires about loperamide to stop the diarrhea. What will you advise? One sentence. No, we can't give loperamide in infectious diarrhea.
Okay, why? This is just an extra question I'm asking. Why?
Why? I think loperamide, there is some kind of complication. I can't really recall it, but we don't give it.
Yeah.
It can get worse, maybe.
Yeah, because the point is that, the person has infectious diarrhea and you want the organisms to, just go away, right? You want the diarrhea to just run. And if you're not careful, then you're just going to let it bump up in the GI tract and it's going to cause trouble, okay? So don't do loperamide to stop diarrhea. No, don't do that, okay? Good. Let's go on. Yeah, risk of toxic megacolon. Awesome. So let's go on. So antimotility drugs are discouraged in the context of C. difficile colitis because they can cause toxic megacolon. That's the truth. Okay, so who else is going to volunteer and read the next question for us? As I said, we have 10 questions to review, and I think they are very, very important for us to do that. Next question, please. Who is going to read that? Dr. Mohammed, will you want to try again, or any other participant?
Okay,
yeah,
I wanna try.
Dr.
What is your next step after prescribing the medication you decided in the question 2?
Yeah. So remember that in question 2, we talked about those 3 medications.
Yeah, vancomycin,
metronidazole, and fidaxomicin. So
yes.
apart from that, what is your next step after prescribing the medication you decided on in question 2? Any help, Dr. Laurie?
I will ask to take some fluid, like.
You will encourage some fluid. Okay. What else? Will you want to read the question again? 56-year-old patient on pantoprazole.
Stop the antibiotic.
Beautiful. Beautiful. That is it. Stop the oral ciprofloxacin.
Oral ciprofloxacin, yeah.
Stop the antibiotic. That's it. Stop the antibiotic. Some authorities will also say that change the antibiotic to one which causes less symptoms. But for now, stop the antibiotic, okay? Stop the antibiotic. Question 5. 56-year-old, the same patient who wants to try this fast. How could the above condition be prevented from occurring? How could the above condition be prevented from occurring? Any help?
Pantoprazole, doctor, probably should be stopped. I think
Sure.
it contributes. Yeah, thank you.
Prescribe less broad antibiotic in the future, more specific
Okay.
antibiotics.
So prescribe less broad antibiotic. What else? And then someone also said, stop pantoprazole. But you know, you didn't know that the patient was going to get this thing. So you have a patient taking pantoprazole. You need to, for example, a patient has very bad acid reflux, and you need to continue giving pantoprazole, and you need to add on an antibiotic. What would you have done to prevent this from, like, this infection from occurring? Any other suggestion? So Dr. Kwan Limu says fecal biotoma transplant. Sure, that is an option, but that wouldn't prevent this from occurring. That is used to treat C. difficile. That is not to prevent it. So what could have been done? What could have been done is that the patient could have been given probiotics. Probiotics, you know, probiotics. And the TDM exam is quite straightforward that way. Probiotics. So if you are going to give, you know, antibiotics for a long time, or say somebody maybe had a particular condition and you have to give a different antibiotic. So far as you are giving the antibiotics for a protracted period of time, please prescribe some probiotics as well for the patient. Okay, let's go to the next question. Today's session will be very short because it's just straight to the point. Please, I need somebody to read for us. Somebody to read for us. Somebody to read for us. A probiotic, just indicate probiotic. That's it. Like yogurt or, you know, any of that, because Dr. Daddy is asking, what is an example of a probiotic? Usually, if you write probiotic for even in Canada, the pharmacist will serve it. Okay, yeah. All right. And who is going to read the next question for us, please?
A 46-year-old male comes into your clinic inquiring about having a dental procedure. He used to use IV drugs and starts that he was admitted to the hospital 7 years ago and treated with antibiotics for a life-threatening heart infection. What will you prescribe for him? Indicate the medication, dose, and route and timing.
Yes. So
Okay.
what is this question about? 46-year-old male in the clinic wants to have a dental procedure. What does it tell you? He used to use IV drugs, and he states that he was admitted to the hospital. Beautiful, beautiful, beautiful. Dr. Salwa is getting the answer right. What do you think? Infective endocarditis, sure. So now the question is asked. So you see the way the question is, they will not tell you maybe a 46-year-old male comes to your clinic with a past history of infective endocarditis. But look at the way they put the preamble. And you have to be able to tell that, look, okay, this is what this thing is pointing to. All right, okay, good. So now, what will you prescribe for him? Indicate the medication, the dose, the route, and the timing. So this is a four-pronged approach. So this question may carry 4 marks. So you don't need to know only the medication. We want the dose, we want the route, and we want the timing. So that means there's something unique about, you know, prescribing whichever medication you want to give in a case like this. So I've seen Dr. Rodisa and then Dr. Laura writing some answers in the comment section. Now, what is the medication? When you state the medication, state the dose, state the route, state the timing of the medication.
If I try amoxicillin, I will set amoxicillin 500 milligrams. I will try BID, but most of the time
what is the
take it
timing?
BID for 14 days.
Sure, this guy is just going to have a dental procedure.
It's one dose, 30
And
minutes
it-
before procedure, doctor, right?
1
How
hour
many-
before procedure.
Yes, it
For
has to
7
be
days.
before
Yeah,
the
1 hour.
One dose.
Okay, good.
One dose.
So the answer is that you can give amoxicillin 2 grams PO times 1 dose. It is just 1 dose. It is not for 14 days.
Okay, 3.
For 30 to 60 minutes before the procedure. And remember, I'm putting this thing in yellow again. Ranges were written for teaching purposes. In the exam, write a single duration and stick to it. So you can write amoxicillin 2 grams PO times 1 dose 30 minutes before the procedure, or amoxicillin 2 grams PO times 1 60 minutes before the procedure. Any of those two is right. But don't write 30 to 60 minutes. No, that is wrong. Don't do that. If you do that, that is wrong. Okay, good. Now let's go to the next question. Your patient's allergy list, the same patient.
Sorry, doctor. Sorry. That means we can write amoxicillin 2 grams per ox for like 1 dose only.
If you
Don't
write
have-
per 1 dose, look at the question very well. The question says, indicate the medication, the dose, the route, and the timing.
Yeah.
So that means if you write, yes, so amoxicillin 2 grams PO. So that means you will get 3 out of 4.
Yeah.
You get me? You need to write the timing to get the full mark. And that is one thing, like we go into the exam, a lot of us we know exactly what we have to do. But then at times, I don't know what happens, maybe we don't read the question clearly and we may miss some components of it. That is it. So in this exam, take your time, because the exam could have asked lists or what drug class instead of the prescription. What drug class will you give? So that means you are going to talk about giving a penicillin, okay? But this time it says indicate the medication, the dose, the routes, and the timing. So this one, just go, bam, amoxicillin, dose, 2 grams, route, PO, timing, 30 minutes before the procedure or 60 minutes before the procedure. Any of that is correct. So that's what I have. Yeah. Okay. Now, your patient's allergy list later, and you review the patient's allergy list later and realize that the patient is allergic to your first line medication. What other option would you consider? Indicate the medication, the dose, the route, and the timing. Will anyone want to try it? So somebody with past history of infective endocarditis, the person is going for a dental procedure. The person has allergies to your first line medication, which is amoxicillin 2 grams PO times 1, 30 minutes before the procedure. What other option will you give? What dose? What route? What timing will you give? So Dr. Misbah says Kefalexin. Dr. Rasha says Zithromax. Sure, Dr. Saraidip Sandla says, if allergy, now clindamycin. Awesome. So the answer is that if the person has a past history of infective endocarditis and the person is going to get a dental procedure and the patient has allergies to amoxicillin or penicillin, go for clindamycin. This time, go for 600 milligrams PO times 1 dose, 30 minutes to 60 minutes before the procedure. No, so usually these are the 2 medications they give, and it is in the RX files as well. So this is the book. You need 2 books, frankly, and the administrator will put the book list in the, like recommended book list in the chat box. But if you get these two, you should be fine for the exam. The CTC and then the RX files, you should be fine for the exam. Okay. Yeah, we'll put it in the comment section so that you can also check out the link and know how you're going to get it. So clindamycin and amoxicillin are the ones we're going to use. Okay, we are trying to wrap up. We have 3 more questions to go. So yeah, this 46-year-old gentleman again, list 2 other patients who may need the medication you provided in cases 6 and 7 above. So which other patients may need the medications you prescribe if they are going for a dental procedure? Because we've seen that a past history of infective endocarditis warrants that you give amoxicillin or you give clindamycin. Now, which other patient will also need antibiotic prophylaxis before a dental procedure? That's the question.
Abscess.
Abscess where?
Can be dental, can be buccal, sorry, can be any, can be over the lungs as well. Lungs or dental.
Where did you read this one? Where did you read this one? You know, artificial valve, beautiful. That's beautiful, Dr. Loy. Artificial valves, that's good. Valvular heart disease, Dr. Ifeoma. Okay, so it's number 1, patients with valve replacement. That's artificial heart valve. So Dr. Ifeoma, don't even write artificial valve. Where? So artificial cardiac valve replacement, okay? Patients who are 6 months post congenital heart repair. So artificial heart valve, 6 months post congenital heart repair. And then cardiac treatment or surgery with valve regurgitation due to a structural abnormal valve. So anyone who has had a cardiac surgery with valve regurgitation also needs it. So infective endocarditis, past history of valve replacement, 6 months post congenital heart disease repair, and if the patient had cardiac treatment surgery with valve regurgitation, you want to give them antibiotic prophylaxis. Now we're going to our last 2 questions. As I said, today's session is going to be super short. So, 20-year-old male came to your clinic with a history of stuffy, runny, and itchy nose for the past 2 days. He has noted yellowish and greenish discharge today. What antibiotic will you provide the patient? What antibiotic will you provide the patient? What antibiotic will you provide this patient? Anyone going to help us?
Amoxicillin should be.
Says Genta. Kwan Ling Wu says amoxicillin. Dr. Rhodesia says amoxicillin. Dr. Salwa, awesome. Dr. Crespo says amoxiclav and Vanco. Do you want to know what Dr. Salwa, please, can you unmute yourself? Okay, Dr. Humira also says something. Dr. Humira or Dr. Salwa, please, can you unmute yourself and tell me why you chose the answer you chose?
Because there are just 2 days.
Sure, and it could be what? It could be viral. And this is very important.
Yes, it could be only viral infection. It's
so
not yet proved to be
says that
bacterial.
do not prescribe antibiotics. And the teaching point is that from CTC and also from RX files, okay? 12th edition, that is the latest edition. I think so, yeah. This is how the latest edition looks like. Yellowish, greenish discharge is not indicative of bacterial infection. So if you go to page 100 of this book, that is what is there. But you know, a lot of patients will come, and this one can easily beat you. Oh, doctor, you know, I have runny nose and it is yellowish, it is greenish, and because of that, I'm concerned. No, that is not an indication for antibiotic. That does not mean that the patient has bacterial infection. So, with that in mind, what treatment will you recommend to this patient? List 2. What treatments will you recommend to this patient? List 2. I'm checking the answers. Okay. Supportive. So, Dr. Rhodesia, when you say supportive treatment, what do you mean? Dr. Crespo says nasal.
Yeah, doctor. Nasal irrigation with normal saline. Yeah, and the congestion also.
So will you want to state that clearly, you know, in the exam, right? Don't just say supportive treatment. You can even write supportive treatment like, so that it is clear. Because then the examiner is a bit confused about what to do about your answer. The examiner knows what you are trying to say, but the examiner cannot give you the mark if you are not specific. All right? Okay. So the options can be decongestants, and this is also from CTC. How many of us have CTC, by the way? No, RX files, by the way. Please, do you have RX files? It's a very good book, very, very good book, but it's very loaded. Okay, this is how it looks like, very loaded, but it's very good. If you want to revise very well for your exam, for the TDM exam, and then the CTC are the books you need. Okay, so you need decongestants, saline nasal irrigation, and steam inhalation. These are the medications you want to, or when I'm done with this lecture, I'll look for the soft copy link for you, please. I'll look for the soft copy. So please watch out in the comment section. All right. So decongestants, saline nasal irrigation, and steam inhalation. So yeah, that is it.
Here, I have a question.
Please ask.
In exam, do we have an option to go back to the previous question and make it correct?
You do. Yeah.
Okay. And in case there is any dosage problem, is the calculator available to calculate the dose?
Yes. For example, in pediatric cases, you may be given the weight, and you just have to use the weight to calculate. So whether it's amoxicillin, and as I said, don't write ranges, because amoxicillin, depending on the patient's presentation, you can start from 40 milligram per kg to 90 milligram per kg. So choose one and stick with it. Okay? And don't try to learn too many medications which belong to one drug class. Take one drug class, learn 2 or 3. Antidepressants, learn 2 or 3. Antidepressants, no antidepressants you use in pregnancy. Antidepressants you can use in breastfeeding, because and then whatever topic you are learning, ask yourself, this medication, how does it apply to pregnant women? How does it apply to breastfeeding mothers all the time? So when you are doing whether infectious diseases, whether you are doing, say, UTI, which medications are pregnant, and then the CTC has also outlined it. They are done.